Good afternoon. My name is Ricardo Zurita, and I'm going to talk about a 78-year-old man with hypercalcemia and renal failure. Well, definition. Hypercalcemia is a condition in which the calcium level in your blood is above the normal. Too much calcium in your blood can weaken your bones, create kidney stones, and interfere with the way your heart and brain works.
Hypercalcemia. Patients are hypercalcemic when their levels are greater than 10.5 milligrams per deciliter. Patients may present with pathologic fractures. Furthermore, patients can have lethargy as hypercalcemia can lead to hypercoagulation. Constipation is another manifestation along with ECG changes like short QT and ST segments. Interventions for this condition include no extra calcium intake. Chelating drugs can be used for hypercalcemia. Calcitonin is a drug which
Well, applications in medicine. The severity of symptoms is related not only to the absolute calcium level but also to how fast the rise in serum calcium occurred. Mild prolonged hypercalcemia may produce mild or no symptoms, or recurring problems such as kidney stones. Sudden onset and severe hypercalcemia may cause dramatic symptoms, usually including confusion and lethargy, possibly leading quickly to death. Serum calcium levels greater than approximately 15 milligrams by deciliter usually are considered to be a medical emergency and must be treated aggressively.
Acute kidney injury, or AKI, is when the kidney is not functioning at 100%, and that decrease in function usually develops relatively quickly, typically over the course of a few days. Actually, AKI used to be known as acute renal failure, or ARF, but AKI is a broader term that also includes subtle decreases in kidney function. AKI can essentially be split into three types. Pre-renal AKI, meaning the cause of the kidney injury is coming before the kidneys, post-renal AKI, meaning after the kidneys, or intrarenal AKI, meaning within the kidneys. Now, the kidney's job is to regulate what's in the blood, so they might remove waste or make sure electrolyte levels are steady, or regulate the overall amount of water, and even make hormones. The kidneys do a lot of stuff. Blood gets to the kidneys through the renal artery, into tiny clumps of arterioles called glomeruli, where it's initially filtered, with the filtrate, the stuff that gets filtered out, moving into the renal tubule. Sometimes fluid or electrolytes can move back from the filtrate into the blood, called reabsorption. And sometimes more fluid or electrolytes can move from the blood to the filtrate, called secretion. Along with fluid and electrolytes, though, waste-containing compounds can also be filtered, like urea and creatinine. Although some urea is actually reabsorbed back into the blood, whereas only a little bit of creatinine is reabsorbed. In fact, in the blood, the normal ratio of blood urea nitrogen, or BUN, to creatinine is between 5 and 20 to 1, meaning the blood carries 5 to 20 molecules of urea for every 1 molecule of creatinine. And this is a pretty good diagnostic for looking at kidney function. Ultimately, that filtrate is turned into urine and is excreted from the kidneys through the ureter into the bladder and peed away.
Symptoms due to high calcium level may vary depending on the cause and how long the problem has been present. They may include digestive symptoms such as nausea and vomiting, pure appetite or constipation, increased thirst or more frequent urination due to change in the kidneys, muscle weakness or twitches, changes in how your brain works such as feeling tired or fatigue or confused, bone pain and long-term spine changes in the bones have become thinner or weaker.
Hello, This is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about hypercalcemia, or high calcium levels in your blood. Hypercalcemia means that there is high level of calcium in the blood. The most common cause, 9 out of 10 times, is parathyroid gland that is too active. This is called hyperparathyroidism. The parathyroid glands are under the thyroid gland. They regulate calcium in your body. Other causes include medications like lithium and thiazide diuretics, which are water pills, also vitamin A, kidney problems, illness that cause bone to break down. This leads to extra calcium in the blood. Some cancers can make a hormone that releases calcium from the bones. Some cancers spread to the bone and cause the bone to break down.
In conclusion, acute renal failure is a serious medical condition that could complicate the course of many of your patients. The mortality rate from acute kidney necrosis is around 50% and hasn't changed much over the past 3 decades. Despite significant advances in supportive care, mortality rates differ, however, depending on the cause of renal failure. Rates around 15% in obstetric patients, around 30% in toxin-related acute renal failure, and around 60% after trauma or major surgery. Thank you.